Hello everyone, in this video I'm going to show you the steps to take the blood pressure of an individual. For consistency, we use the left arm, and keep in mind that the arm should be on the table at rest at the same level of the heart. And we use the brachial artery to take the blood pressure above elbow, medial to biceps brachia, which is this muscle. We can detect the brachial pulse. I take a mental image of that spot because that's the place that when I take the blood pressure, I place my stethoscope on. To take the blood pressure, we use sphygmomanometer, which I'm sure you have seen sphygmomanometer. It has a cuff, which we wrap it around the arm about 2 centimeters above elbow. It has a meter. You use this to actually see exactly the numbers for systolic and diastolic. Please make sure that the tubes are in front of the elbow, and there is a bulb that we use this to inflate the cuff. If you use this style of sphygmomanometer, before inflating the cuff, make sure using clockwise, close this. That's very important because without closing it, the air doesn't go to inflate the cuff. And as I mentioned, we use stethoscope and we place it exactly on the spot that we detected the brachial pulse. So I am ready to start taking the blood pressure of this individual. How much I'm supposed to inflate the cuff? The recommendation is 30 to 40 millimeter of mercury above systolic, but since we don't know what the systolic blood pressure of this person is, we just go up to 180. That's usually good for most individuals. So I make sure that this is closed. I quickly pump, and when I get to 180, I stop, and then I go counterclockwise to very slowly deflate the cuff. And I'm looking at the number and at the same time listening. When it gets here, let's say, if this is a real person, I start hearing a sound. So the moment you hear a sound, that number is your systolic blood pressure. Then you see the needle keep bouncing, and when you get to the spot that you no longer hear a sound, that would be your diastolic blood pressure. When you have the diastolic, then completely deflate the cuff. So the concept simply is that by inflating the cuff, you completely collapse the brachial artery. And when you slowly deflate the cuff, you're waiting for the moment that left ventricle, using the forcefulness of its contraction, pushes blood and opens the brachial artery. Exactly, that's the first sound that you hear. And since brachial artery is not exactly back to its normal diameter, the wall keep going like this. So that explains a little bit the bouncing that you see, and you keep hearing the sound that blood is flowing through the brachial artery. And when brachial artery gets back to its normal diameter, you stop hearing the sound. And that would be exactly the lower pressure that you can detect on the wall of brachial artery. That's your diastolic blood pressure. So these are the steps, and there are a few notes that we need to know about. What if the first attempt you do not detect systolic or diastolic blood pressure, or both of them? Please do not take the blood pressure back to back. In that case, if you fail, we have to open the cuff and let the individual rest for a couple of minutes, 2 to 3 minutes, or you can wrap this around the right arm, but never back to back take the blood pressure, because that gives you the false result. I hope you find this helpful.